So continuous powered aspiration or mechanical thrombectomy is a way to have sustained suction force delivered through a catheter. In this particular application that we're talking about today with the CHEETAH trial, it's done within the coronary arteries. Historically speaking, things were done with, or aspiration was done with manual aspiration. So essentially a suction syringe or a backlog syringe that would give some degree of suction force that would quickly be attenuated over time. And the difference between that in comparison to this system, which is continuous aspiration, is that you're able to have sustained effects throughout the duration of the procedure. So the CHEETAH study was a prospective study with 400 patients with high thrombus burden presenting with acute coronary syndrome. So this is grade 4 or 5 thrombus, and if post-wire crossing they had a high thrombus burden, they were enrolled in the study. And in those patients, they all underwent thrombectomy utilizing the CAT-RX system. The study was remarkable in finding excellent results. There were no device-related serious adverse events, but most importantly, the patients all had successful removal of thrombus and improvement of perfusion. So there was essentially over 99% improvement in TIMI flow and TIMI thrombus grade, and also most importantly, extremely high levels, so over 99% myocardial blush grade 3, which has been previously unheard of in other trials of a similar nature. Well, for the longest time, especially after the total trial, which found with manual aspiration, there was really no difference with regards to MACE events, and also more concerning and increased risk of stroke. The guidelines changed from a 2A recommendation for aspiration thrombectomy to 2B, and for routine thrombectomy in PCI to class 3. So we were trying to demonstrate that with potentially advanced technology, which the total investigators did suggest, potentially within the highest thrombus burden subset, that if you could potentially improve upon the existing technologies, that being manual aspiration devices, perhaps the outcomes could be improved. And so CHEETAH is the first step to suggest, and really it's the only major advancement in the STEMI world in recent past, with regards to reinvigorating interest in thrombectomy within high thrombus burden PCI. And what's interesting is that hopefully by demonstrating the remarkable safety and also efficacy of the technology, we can potentially do additional research and potentially push the guidelines to allow for selective thrombectomy in this patient population. The CHEETAH study found the benefits of continuous mechanical aspiration thrombectomy with the CAT-RX system in this high-risk population subset that had significant clot burden in the coronary arteries. So we saw restoration of blood flow and reperfusion quickly in most of the patients, and these positive results really confirm the role for continuous powered aspiration. It's effective. And in a situation where this is really what we call a race against time, because time is muscle, and also these patients are very sick, continuous aspiration improves visualization of the lesions and also potentially may improve outcomes. And this is something that really is a relatively new finding, but something that most interventionalists have aspired to for years. I'm really excited for this space. I think we have a lot of work still to do, but I think that the CHEETAH study and also other subsequent studies hopefully will continue to show that continuous mechanical aspiration thrombectomy is effective and potentially can be a game changer for these patients in the future.